My research focuses on kidney disease, the progressive loss of kidney function over time. 1 in 10 people have kidney disease. That's over 3.5 million Canadians alone. Kidney disease patients have this increased burden of heart disease, stroke, and other complications that result in them dying earlier than the rest of the population. Now, unfortunately, once you've lost your kidney function, you can never get it back. So these patients with kidney disease have to undergo a number of different treatments to sustain life. They have to have their blood cleaned 3 times a week by going to the hospital, having their blood removed, cleaned, and replaced in their body just to stay alive. Now, the good news is doctors can prevent the loss of kidney disease if they can detect it early enough. The problem lies in the test that they have to use to monitor kidney function. So when a doctor wants to determine your kidney function, they take a sample of your blood and they measure a molecule in the blood called creatinine. The problem with this test is that by the time the creatinine level rises in your blood, you've already lost over 50%, half of your kidney function is gone. So by the time a patient is diagnosed with kidney disease, it's often too late for effective therapies to be implemented by their physician. This is where our research comes in. We use a novel and powerful technology called Metabolomics to study different metabolites to try and find a better test of kidney disease in these patients. We applied metabolomics, which we consider to be like trying to find a needle in a haystack, to patients with kidney disease. We looked at patients and we looked at hundreds of different metabolites, and one sort of rose to the top, this molecule called TMap. TMap's not in any of the online metabolite databases, and it's never been studied in kidney disease before. We looked at TMap levels in healthy patients with normal kidney function. We looked at patients who are living kidney donors. They were healthy and they chose to donate a kidney to somebody else, so they only have 1 kidney. And we also looked at this TMap molecule in patients that are transplant recipients. They had advanced kidney disease and they received a kidney transplant, so they also only have 1 functioning kidney. When we looked at this metabolite in these different patient populations, our TMap metabolite was able to accurately predict which patients only had 1 kidney, in contrast to creatinine, this current standard, which was unable to differentiate these patients. So using this metabolomics methodology, we hope that we found the needle in the haystack that is going to help us diagnose chronic kidney disease earlier, allow patients to be diagnosed by their physicians to help extend their life longer by implementing therapies earlier. Thank you very much.